Hello, good day to you. This is Dr. Amihan, your humble servant in health in the northern part of Antique. I will be giving you now updates with regards to the new Omicron variant. It has been there for almost 2 weeks ago. It has been in the news, and it's quite trending that this new variant is highly transmissible, and they said that it's highly infectious and virulent. But I have to give you new updates now because it creates some sort of concern and panic to some other people. Now, this is a case of a person who was been infected with the Omicron variant 2 weeks ago, or maybe nearly less than 2 weeks ago in South Africa. This is a real world experience of this person. Okay, we already know that initially there are 136 cases of Omicron in South Africa, and it further increased to 2,000, and as of December 2, it increases to 4,000 new cases of Omicron infection in South Africa. Now, we will go back to that person who experienced Omicron infection. First, he told in an interview that last Thursday, he experienced throat itchiness, and then sort of mild cough on the next day. That was on Friday. Then on Saturday, he experienced a little bit of an increase of temperature, a slight fever associated with moderate to severe headache. So on Sunday, the next day, he feels like hell. It's just like having a hangover. So he took up vitamin D with zinc and medicines for fever, and went to bed and sleep, and experienced profuse sweating all over the body. Then the next morning, that was on Monday, he feels better, although he had slight throat itchiness and still with cough, mild in nature, and it is occasional. And went to a healthcare agency, a government agency, healthcare facility, and underwent testing for COVID, and it turned out positive together with his wife. So they are the first Omicron variant infected patient, and that's what I've said, survived with disease. So it is really true that this Omicron variant, as stated in the news, that the disease causes mild symptoms, although there are reports that it infects more of the younger population, less than 30 years old, or persons in their 20s and up to 40s of age. And as what I've said, it causes mild symptoms. And some of the infected persons are, many actually are unvaccinated. compared to the vaccinated persons, that Omicron causes breakthrough infections in vaccinated populations. And as of now, Omicron variant is almost in 24 countries, including new reports in the US, in California. So there is a big possibility that this variant of concern will be the dominant variant, and it will displace Delta all over the world, because it has already displaced Delta and became the dominant variant in South Africa. Almost 70% of the genome tested positive for Omicron variant in South Africa. South Africa has a low vaccination rate. It's just 24%. So one of the reasons why the newly highly transmissible variant of concern emerged in South Africa. Now, talking of variant of concern, as stated by the World Health Organization a few weeks ago, and what is the definition of variants of concern? As stated by the WHO. We have to discuss that one. According to the Technical Advisory Group on Virus Evolution, and recommend this to the World Health Organization. So the Technical Advisory Group on Virus Evolution recommend Omicron variant, the B.1.1.529, as a variant of concern to the World Health Organization. And what is the definition of this variant of concern? So the World Health Organization defines this variant of concern as increase in transmissibility or detrimental change in COVID-19 epidemiology. So it has already been shown that the Omicron variant is highly transmissible. No questions with that. And with regards to its epidemiology, it is still being done now, continuously done now. Okay. Now, another definition is there is an increase in virulence or change in clinical disease presentation. So, of this Omicron variant, there is not really had an increase with regards to the virulence, because most of the people who suffered the disease has a mild symptoms. So it is not quite severe. But there is also a change in the clinical disease presentation, because the disease will only present with throat itchiness, cough, and then slight fever, and then headaches and severe headaches and body pains and tiredness or fatigue. So this tiredness, extreme tiredness, fatigue, and slight fever with severe headache, these are the telltale signs of Omicron variant infection in persons. So we have to watch out on these presentations coming from our patients. Although here in the Philippines, there is not yet a case being reported as of the moment as a cause by the Omicron variant. Okay? Now, another definition of variant of concern by the WHO is the decrease in effectiveness of public health and social measures on or available diagnostics, vaccines, and therapeutics. Now, there is not yet a decrease in the effectiveness of our public health preventive protocols for COVID, such as the masking. They are still very effective. Masking, social distancing, avoidance of poorly ventilated space, avoiding super spreader events, washing of hands, masking, putting a face shield. They are still very effective in prevention against getting the disease. Okay. Now, with regards to the diagnostics, this Omicron variant can still be detected by the RT-PCR test. So don't worry with that. And with regards to the vaccine, there is a possibility, and it was already been displayed, that there is some form of vaccine-scape effectiveness. But the vaccine effectiveness was just reduced, but it is not totally ineffective against this variant. There is just only a reduction of the vaccine effectiveness. And then with regards to immune system functionscape, there is a reduction, neutralization of antibodies function. There is a reduction of that as shown by some patients. But studies are still going on up to the present for that type of variants, the Omicron variant of concern. Okay. Many people or many of my patients are asking why there is always a new variant or mutation of the SARS-CoV-2. Why is it that there is always a mutation or a new variant that will emerge? Because they said that it seems that there is no ending of this SARS-CoV-2 thing or COVID-19 thing. It seems that it will not end, and most of the people are tired of always thinking of this COVID infections. So I told them, okay, the coronavirus has been there for almost millions of years ago. So they are here ahead of us. And everybody knows that SARS-CoV-2 belongs to what we call the Coronaviridae family. It is a cousins of the SARS-CoV-1 that caused infections and epidemic in China before in 2002 and 2004. Likewise, it also a relative of your MERS-CoV or your Middle East respiratory syndrome coronaviruses, which also happened to infect people last 2012. It is also a known fact that SARS-CoV-2 infects people through what we call the spike proteins. And these spike proteins has on the tip of this one, of the spike protein, has a receptor binding domain, or what we call RBD, on the tip of this spike protein. Okay? So this is your spike protein of the SARS-CoV-2 example, and this is the receptor binding domain and the tip of this spike protein. So this receptor binding domain will be the one to attach to the ACE2 receptor in our cells. Okay? Now, many are asking why there is always a new variant that will emerge. Because the spike protein and the receptor binding domain has a high propensity to mutate. Okay, to mutate. Reports have said in a paper coming from the National Academy of Science in the US that the SARS-CoV-2 or the coronaviruses family has a mutations of 1.12 times 10 to the minus 3 nucleotide substitutions per site per year. So, you will not be surprised that variants of SARS-CoV-2 emerge quickly and rapidly. Okay? So that is the characteristic of coronaviruses. It has an increased rate of mutations, especially what is happening in the spike protein and the receptor binding domain, which is a target of our new therapeutics against or new treatment against SARS-CoV-2. But what will happen? Because this always mutates. There is an increased rate of mutation in this area. And this is a target of our therapeutics against SARS-CoV-2. So meaning, our treatment sometimes fail as the new variants emerge. Okay? It renders our vaccines and other treatments useless or ineffective against the newly mutated variant. But not all mutations resulted to the advantages for the viruses. There are also mutations that will cause or become a Waterloo or an Achilles heel of the virus. It renders the virus weak, although it is highly transmissible, but it will decrease its virulence. Okay? It will decrease its virulence. So maybe this Omicron variant is now displaces Delta all over the world. It is highly transmissible, but it can cause less severe disease, which is good news for us because it can cause less severe disease. So, it cannot cause death as much as possible, hopefully, because of the decreased severity that this variant can cause. Okay? I would just like to mention with regards to the mutations happened in Omicron variant or your B11529. compared to the alpha variant, the delta variant. Okay, so your alpha variant had a 23, the virus itself of the the alpha virus itself had a 23 mutations known. Your delta had 17, and your Omicron variant had 50 mutations. Of these 50 mutations, the spike protein mutations in Omicron had 32 mutations, and with regards to its receptor binding domain, or your RBD, had 10 mutations. Your delta spike protein mutations had 7, and the receptor binding domain, or RBD, mutations in delta has 2. Your alpha spike protein mutations had 9, and the receptor binding domain, or your RBD, mutations in alpha had 1 mutation. So the Omicron variant surpass it all with regards to the viral mutation, the number of spike protein mutations, and the number of receptor binding domain but recent reports now stated that it causes mild disease or symptoms, which is very, very important to us and favorable to us. The more so that it displaces critical diseases or even death to the persons being infected with the virus. So, Omicron variant, or the B11529, is now beginning to become the dominant variant all over the world. And we are thankful for that. Maybe this variant will stay, and we can develop more of immunity with this regards to this variant through the help of our strict observance of health protocols, and boosting of our immunizations, and giving of more boosters to the populations, especially the vulnerable ones. So this is Dr. Amihan, your humble servant in health in the northern part of Antique, wishing you have the best of everything, and please don't forget to like, comment, and share if you like the video, and subscribe in order to help us. Please do so. Thank you.